Hello everybody and welcome back. We're going to get into cardiovascular emergencies. This is going to be quite the topic. We got a lot to cover, so strap in and hold on. So cardiovascular disease is one of the main killers of people per year, right around 610,000. Approximately all 50% of cardiac deaths are caused by sudden cardiac arrest or sudden cardiac death, however you want to put it. And I think the big one in here is just so that you guys can see right around or approximately 50% of all sudden cardiac arrests or deaths occur outside of the hospital. So basically in your hood, right? This is where you guys play. This is where we need to be proficient in our cardiac anatomy and the disease processes in order to help our communities out. So what does EMS as a profession or a skill set do to help our communities? I think the big one on here is to make sure that you guys are advocates once you guys get out there and really start joining some groups on how to actually teach lay people CPR. We're going to talk about the effects of lay people actually doing CPR, especially the lay people that are doing efficient CPR, and how good of odds it is for our patient in order to get return of spontaneous circulation, also known as ROSC. I'll refer to that again throughout this lecture. But we do have a lot more access to AEDs. Pretty much every big box store has AEDs. They're found in airports. Some of the gas stations have them. All the schools have them. The universities, the high schools, elementary schools, middle schools, they all have AEDs now. And again, is the recognizing the need in order to get advanced life support there, also known as paramedics, or possibly like maybe some kind of consortium doctors if you have those in your area. We do here in New Mexico, so we're very fortunate to have that. This is all you guys, right? You guys need to be aware of the signs and symptoms of cardiac pathologies in order to be able to get the resources that the patient needs during their cardiac emergency. Okay, going back into overview of the circulatory system. We have a pump, we have some pipes, and we have a whole lot of fluid contained in those pipes, right? So remember that the number one goal of the circulatory system is to deliver oxygen to all body cells. Every cell from my head, tip of my head, tip of my nose, all the way down to my big toe, through the arterioles, or through the arteries and arterioles, into the capillary beds, then back through the capillary beds into the venules and the veins. And it's all circulated by the pump, also known as the heart, and then it transports all that fluid, specifically the red blood cells that are the actual hemoglobin that is saturated with the oxygen molecules, in order to perfuse all of my cells and then to help eliminate waste as needed throughout the body. Going through starting the actual anatomy and physiology of the heart itself, remember that the heart is a two-way pump. The right side of the heart always carries deoxygenated blood, where the left side of the heart always carries oxygenated blood. So you guys can see here on this picture, you have the inferior vena cava on the very bottom of the slide, and the superior vena cava. Remember that the superior vena cava brings blood back from the brain, where the inferior vena cava brings blood back from the body to the right atrium. From the right atrium, as the heart squeezes, it passes through the tricuspid valve, ending up into the right ventricle. That blood is then passed through the pulmonic valve into the left and right pulmonary arteries. Those left and right pulmonary arteries go to the left and right lung, respectively. That's where respiration occurs. That's gas exchange at the alveoli level. We have now saturated our red blood cells, or the hemoglobin in our red blood cells, with oxygen in order to be perfused and circulated throughout our system. Once that happens, the blood is then carried back through the pulmonary veins back to the left atrium of the heart. Remember that the pulmonary artery is the only artery in our body that carries deoxygenated blood, and the pulmonary veins, you actually have two. You have two sets. one set of 2 from the right and one set of 2 from the left, so 4 in total. The pulmonary veins are the only veins in the body that carry oxygenated blood back to the heart. Those veins drop the oxygenated blood into the left atrium. Through the left atrium, it goes through the mitral valve into the left ventricle, which is our most muscular part of the heart. The left ventricle squeezes, it goes through the aortic valve and then into our aorta, and then it goes all the way down from our aorta into our arterioles, to our capillaries, where the actual gas exchange occurs through the process of perfusion. And remember that perfusion is where gas exchange occurs at the cellular level, and you also need to have a good adequate amount of pressure in order for that diffusion of oxygen and whatever waste product it's taken its place of. We have to have an adequate amount of pressure in order for that diffusion to occur all the way down at the cellular level in my big toe. Remember that you guys will need to know the blood flow through the whole circulatory system. I'm not too worried about it. You guys did very well on that section of exam 1. So just make sure you guys look over this, and I'm going to skip the next slide. The next slide actually shows the valves of the heart. So just remember it's TPMA, and unfortunately the only professional way I have you guys to remember that is, as I learned it back in school, is the ways to remember the orders of the valve is TP, my ass, toilet paper, my ass, tricuspid, pulmonary, mitral, and aortic. Okay, from right to left. That's how it kind of the blood flows through the valves. So TPMA, TP my ass. If you guys remember that, you guys remember the order of the actual valves of the heart. Here's another graphic that you guys are going to see throughout your EMS careers of the actual blood flow through the heart. Again, just another thing to kind of lay your eyes down in order to kind of visualize the actual process of what I just explained on the last slide. Make sure that you guys are able to do this and be able to do this thoroughly, specifically you guys going to paramedic land later on, and hopefully this gives you just a better visual of what we just talked about in the last slide. When we're talking about the distribution of blood, we actually have 2 different types of circulation in our body. We have our systemic circulation and our pulmonary circulation. The systemic circulation is basically the movement of the blood from the left side of the heart all the way down throughout the tissues of our whole body. The pulmonary circulation is the movement from the right side of the heart into the lungs. Okay, so remember, you were dealing with a 2-sided pump. Right side is always deoxygenated, left side is always oxygenated. So remember that you guys need to know the difference between systemic and pulmonary circulation. Straight up flashcards for you guys, but really, if you really think about it, it will kind of make sense, these definitions. So just remember that when we're talking about systemic, we're talking about oxygenated blood moving from the left ventricle through the aorta and then being dispersed however the body needs it to all the cells of the body, where the pulmonary circulation is basically coming from the right ventricle into the lungs in order for that deoxygenated blood to become oxygenated. Okay, so when we're talking arteries and arterioles, the arteries are the big pipes. The arterioles are actually the arteries getting smaller and smaller and smaller. It's kind of like the bronchi in the lungs turn into bronchioles, and those kind of get smaller and smaller and smaller all the way down to a microscopic level, also known as capillaries. So we do have the aorta, which is basically contained in our core. It's in our chest and abdomen, and then it branches off pretty much in our pelvis to create the left and right femoral arteries, which goes all the way down to our big toes. We have the arteries that branch off of our actual aorta. As soon as it comes out the heart, specifically going straight to the brain, our brain wants the most saturated oxygen, the freshest blood, in order to make sure that the brain is able to keep functioning for our other organs as well. And then we have coming down from the upper extremities and kind of going through our external organs, and then our arteries are going to branch off into smaller and smaller and smaller arterioles. Those arterioles are going to keep getting smaller and smaller and branch off more and more, and they're going to turn into capillaries. Okay, so opposite of arteries, we have veins and venules. Veins carry blood back to the heart. The vena cava is actually the largest vein in your body, and it collects blood from the superior, from the brain, and inferior, from the body, back into the right side of the heart. The vena cava is a very big vessel, and it can actually act as an arterial bleed if we are dealing with some kind of trauma or some kind of event where that vein actually gets severed. Then we do have 4 pulmonary veins. Remember, those are the only veins in the body that carry oxygenated blood, and those veins carry oxygenated blood back to the left side of the heart, specifically the left atrium. And then those veins are going to get smaller and smaller and smaller. And they're going to turn into venules, and those venules are going to get smaller and smaller and smaller, start to branch off, and also turn into capillaries. Then we have capillaries. These are basically the connections between the arterioles and the venules. So we have the blood leaving the left side of the heart. The left ventricle comes out to the aorta. The aorta kind of starts to move down our body and kind of starts branching off into smaller arteries. Those arteries start getting smaller and smaller and smaller and turn into arterioles, still branching off as they're turning into arterioles, and then those arterioles get really, really small, almost microscopic, in order to fill our capillaries. Once it turns into capillaries, then once the gas exchange occurs through the process of perfusion or the process of respiration, depending on where the gas exchange is occurring in the body, those capillaries will remove the waste. Oxygen will be unloaded, the waste will be offloaded. Then it'll be carried back through the venules, and those venules are going to start getting bigger and bigger and bigger and bigger and bigger, and kind of collecting more from where they're branching off, and then they're going to turn into veins, and then that goes right back into the superior and inferior vena cava, and this process goes on over and over and over until you die, right? So just remember that they allow contact between the actual blood and the cells, and you have billions of capillaries throughout your body. I don't remember where I read it, but somewhere somebody told me that, like, I remember reading that, like, if you bit all of your capillaries and you string them out in a straight line with your arteries and your arterioles and your veins and your venules, it can, like, wrap around the earth like 3 times or something like that. Don't quote me on that. My memory is not the best it was back in the day, but I remember reading something like that back when I was in school. So, and again, all they're there for is to facilitate oxygen exchange and waste removal at either the cellular or the alveoli level. Again, some vocab for you guys. Just like systemic and pulmonary circulation, we're going to do the difference between systemic capillaries and pulmonary capillaries. So systemic capillaries allow for the distribution of oxygen and other vital nutrients at the cellular level, and then vice versa. It allows for the removal of any kind of metabolic waste, such as carbon dioxide or possibly some lactic acid or some other kind of acid that's actually in your body. Pulmonary capillaries, they allow for the delivery of carbon dioxide to the alveolar tissues for exhalation, and they allow for the absorption of oxygen. Okay, moving into circulation versus perfusion. Going back to our good friend FIC. This is FIC 3 and FIC 4. So we covered FIC 1 and 2 in respiratory. Ventilation, got to be able to have the mechanical movement of air in and out of our lungs. Respiration, we have to have good partial pressures in our lungs, good pressure gradients in our lungs, and be able to unload oxygen through our alveolar beds and offload our CO2 so we can get rid of that process through exhalation. Now we're getting into circulation and perfusion. So we have to have a good pump, we have to have decent sized pipes, and we have to have enough fluid in order to accommodate that. So circulation is the movement of the blood through the various blood vessels of the body, and of course this is driven by the actual pump, also known as the heart. Perfusion, we need that adequate pressure, right? We need that adequate pressure in our body. We need enough fluid in our body. We need our vessels to be able to dilate and contract accordingly. Again, all controlled through the autonomic nervous system. We have no control over that whatsoever. It's 100% involuntary. And we need the pressure in the blood in order to get nutrients into the cells, to get waste out of the cells, and then make sure that the oxygen leaves the blood and enters the cells through the actual pressure that's created through the process of perfusion. Here's a good visual of all of our major vessels in our body. You can see the actual mediastinum, where all the great vessels are actually contained, specifically the parts of the vena cava, the actual arch of the aorta, all your carotid arteries and jugular veins and stuff like that. And you can kind of get a glimpse on how this actually kind of branches throughout the body. So again, with coronary circulation, the heart gets some pretty rich blood very shortly after it's pumped out of the aorta through the left and right coronary arteries. And the heart actually gets the circulation to its own muscle cells during the act of diastole. So when we're talking about the systolic and diastolic pressures of our patient, when we're talking about diastolic, we want that number to be pretty low, as low as basically we can get it without kind of causing any kind of problems for us. But your range that I put you guys through is anywhere between 60 and 90 on the diastolic. So we kind of want that diastolic to be there. Any higher, and we're actually really pumping that blood too quickly into our heart muscles, and our heart muscle cells are still getting perfused, but it's actually kind of creating more pressure on the muscle, and that's how we start getting kind of enlarged heart tissue, enlarged heart muscle cells and whatnot. So just remember that the heart gets circulation during diastole, specifically for this test coming up and for National Registry. Okay, and the heart is again a two-sided pump. The right side receives oxygen poor blood, or deoxygenated blood, however you want to say it, from the body and pumps it into the lungs, also known as pulmonary circulation. And the left side of the body receives oxygenated blood from the lungs and pumps it to the body, also known as systemic circulation. So when we're talking about the actual chamber functions, the actual atriums, both the right and the left, are only there to prime the right and left ventricles. Okay, the ventricles are basically the power or the stroke, very muscular, or much more muscular than the actual arteries themselves. And remember that right ventricle is pumping the blood into the lungs, and the left ventricle is pumping the blood into the body. So your left ventricle is by far the strongest part of the muscle. It's the most muscular part of the strongest part of your heart. It's the most muscular part of your heart. This actually, as it pumps blood, it creates arterial pulsations. These are where we get our central and peripheral pulses. Remember, when you guys are feeling for a pulse, whether it be on the temporal, if it's a kiddo, or maybe even some adults, or the carotid, or the brachial, or the radial, you got your popliteals, or your pedal artery, wherever artery that you guys are wherever your pulse point is, where you guys are trying to feel for a pulse, all you're technically doing is pushing that artery up against a firm structure. And as you're feeling for the pulse, that's technically the left ventricle pumping the blood out. That's how we get our heart rates. And when we're talking about blood pressure, the systolic blood pressure is when your heart is at work. And then the diastolic is when the actual heart is at rest. And make sure that you guys are reviewing your quote-unquote normal ranges for systolic and diastolic blood pressure also before you guys go into this exam. Okay, so in your blood, we have in the intravascular space, so this is the space that the circulatory system is contained in. Obviously, we want our blood to maintain in the intravascular space, but we do have fluid. Basically, fluid is just plasma, also known as plasma. It's actually used to help transport nutrients and waste throughout the body. We have our red blood cells, which is the hemoglobin. The protein structure of the hemoglobin is what actually carries our oxygen molecules from point A to point B for us. We have white blood cells that help fight infections, and then we have platelets that help aid in clotting. So again, you guys have ever cut yourself and you guys have a scab on your on your skin. That's really just a whole bunch of platelets kind of forming in order to stop the bleeding and aid in the clotting factors for us.